Kamudar Pratap Singh, you're joining us on NewsX. The Health Ministry has informed that a total of 101 cases of the new COVID variant Omicron has been reported from 11 states. New daily cases were recorded below 10,000 for the past 20 days. The case positivity for the last 1 week was 0.65%. Currently, Kerala is contributing 40.31% of the total number of active cases in the country. Meanwhile, Delhi Health Minister Satyendra Jain has said 10 new cases of Omicron variant were reported in Delhi, taking the total number of cases of the variant here to 20. A total of 10 people out of these 20 have been discharged. India is administering COVID-19 vaccine doses at the highest rate in the world, and the daily rate of doses administered, in fact, is 4.8 times the rate of doses administered in the US and 12.5 times the rate of doses administered in the UK. Omicron has spread, though, 4 times faster as the Delta variant. In the UK, it already accounted for nearly 40% of all cases and is predicted to replace the Delta variant by Christmas. Joining us to discuss this in further detail is Padma Shri Dr. Sanjeev Bagai, Chairman and MD Nephron. We also have Padma Shri Dr. Mohsin Wali, cardiologist and physician, joining us live. Dr. Ishwar Gilara, infectious disease specialist and health expert, is also with us live. Also joining the broadcast is Dr. D.K. Gupta, CMD Felix Hospital. Let me begin with you first, Dr. Bagai. Clearly, of course, it seems that the Omicron spread is happening at a rapid pace across the world, particularly in the United Kingdom. But as far as India is concerned, would you categorize the risk as low, moderate, high or severe?
Good evening. So no graph actually as a trajectory or a projection graph as prediction can be intuitive or accurate, because human behavior is always unpredictable. And if you say that Delta was precipitated by and large by society, maybe through lack of knowledge or misinformation, or this present wave can actually be precipitated like it is in other parts of the world, very much through arrogance. So I don't think we should take this lightly. This is spreading worldwide in more than 30 or 35 odd countries. More than 60% of the samples in New York last night tested were of Omicron. 13% of all UK samples are Omicron. In India, of course, the vaccination now crossing 136 crores is one of the life-saving preventive tools. So I think India is still in a better shape. We are running about always in all the cycles and surges of the world 2.5 months later than most of the Western countries. So it is good time to prepare. The take-home message is basically for all the audience who are watching this program is get yourself double vaccinated. Wait for the government to give directions for the third vaccine, which will be primarily for the vulnerables and the healthcare workers, frontline workers and immunocompromised as and when they approve it. Always wear a mask. This is still an airborne infection. We are forgetting that this can travel more than 60 feet. It can go as a micro aerosol from room to room. So wear an appropriate mask, a well-fitting mask. This is a festive season. Please be careful not to attend close cluster gatherings in crowds, marriages. This is winter season in most parts of northern India, where the relative humidity and the lower temperatures help transmit this COVID viron much more. Pollution also tends to precipitate the transmission much more. We know that the transmission can also happen indoors, so take adequate precautions. Do not hide your symptoms. Omicron again is a variant. It is more transmissible, but it is so far not showing the same lethality as Delta. Maybe one is because of the genomic nature of this virus, in which it is involving more of the bronchus, according to the Hong Kong study. It is 70 times more transmissible, but 10 times less lethal as compared to Delta. This is still just the initial data which has come from Hong Kong University, but no complacency at all. The next 2 months, and again I'm repeating, the next 2 months, that is December and January, will decide how the entire next year will go. So the ball is in the society's court. Get yourself vaccinated, wear a mask, be careful not to come in close clusters, gatherings, poor ventilated spaces. That will be a bad omen for spreading this infection.
Okay, so a lot depends on the next couple of months. Dr. Wali, is that something you agree with? A lot will depend on the next couple of months on how fast this rapidly spreads in India. Do we require then just, of course, the basic amount of COVID precautions to be taken, or do you believe certain restrictions also are needed particularly in states where the spread is a bit more rapid?
Yes, Uday, thank you very much for bringing me in. Uh, I was seeing the map of India. This is starting from Maharashtra upwards, and the northern area is free. It is showing no rough representation. So this is something which is spreading from the west upwards, from the south upwards toward the north, east, north. Of course, northeast is still free, but it is spreading towards that direction. So this is basically travel which is causing a spread. You are very right. Next 2 months are full of precautions because of 4 or 5 reasons Dr. Bagai just explained. Mainly, first, I will keep travel. Second is people are out of bounds. They are moving around freely, hosting functions, forgetting mask, forgetting COVID appropriate behavior, and also forgetting Delta, which is amongst us. This is a big point. Everybody should realize we are talking too much and having so much general knowledge about this new viron rather, and we are forgetting the old enemy which is still around us, with us, and can harm. This virus can produce less symptoms, and who knows, tomorrow this may partly mutate or fully mutate. And this is a behavior of virus, which the big word is unpredictability. So, Udayji, I would say very earnestly that please do not go into the policies or lockdowns. There is one new thing has creeped in, Dafa 144, CRP 144. And this can be a model for other states also if they think this can be done. I don't advise anything to be done from my side. This is wholly administrative, and they should test more cases. You see, we have to be smart in catching this. We have to devise a faster method, and presumably a kit had come 2 or 3 days back. We had heard something about that, but nothing has come in the fields. So waiting time after the test is the worrisome time, and that creates a lot of stress. And we have been telling repeatedly that stress would be negative, having a negative effect on the human body. So avoid that. The best thing to do is wear mask constantly and appropriate COVID appropriate behavior to follow. But most importantly is complete your vaccination, as Dr. Bagai has just now reiterated. I would say this somehow about this Omicron, the spread of information had been very rapid. People have got sensitized, governments have got sensitized, adequate precautions are being taken, but neglect is also increasing from the point of view of Delta virus, and that may harm us. And luckily, some medicines have also been talked about with this reference, and I don't want to mention them. There are oral one and also a monoclonal antibody has been touted recently in one of these studies from UK. So these are like molnupiravir, Paxlovid, and nivolumab. These are academic things. I must not talk on a public forum. For the public, most important thing is do not forget your own safety, because in your own safety depends the other's safety, society's safety. See the Bollywood, what they have done. And the BMC had first time expressed the anguish about the irresponsible behavior of the candidates there. And this was not talked before during second wave, Delta wave, and so many things. South African president had suffered. So all these things are coming back again. VIPs like heads of the states. So all this is changing. It is changing its behavior. So we have to be very careful, and time would tell us how much variation in the genome sequence will take place in future, because this is a virus which arose from a sick man who was suffering from HIV. If that is correct, then we don't predict anything. Scientists have to observe it. They have to quantify the infection, but there should be no unnecessary scare about this. As very nicely said, it is transmissibility is more, but lethality is less. But that does not mean care should be less. So care should be optimal, complete, most disciplined, and no going to markets, no going to parties, and sitting in the closed spaces. We reiterating again and again We are saying it again and again. And the South African data and the South African doctors are repeatedly emphasizing that world is taking more cognizance of this than is required. I would not agree with that. We should take cognizance of it because it is unpredictable virus, Bhairupia virus, as our Prime Minister, Honorable Prime Minister has said much earlier. And this is showing colors. So this is one of the color it has shown. Future would tell us in next 2 months what is going to happen. So we have to be very careful and very particular about the mask.
Right. Dr. Ishwar Gilada, come in here. Dr. Ishwar Gilada, now, we've seen Maharashtra, your home state, also, unfortunately become an epicenter of COVID every time a wave has hit the country. Do you see a danger as far as Maharashtra and Omicron are concerned? Or will it perhaps be important to contain its spread in other parts of the country where perhaps antibody presence is not as much as states which have been hit hard in the first couple of waves?
I will go with my seniors, and they have emphasized very well. What I would like to tell that currently Omicron has come for the human beings good. At least the lackluster behavior about masking and the vaccine hesitancy which was growing in last 1.5 months, 2 months, it is now reverse. So Maharashtra has done record vaccination in last 15 days time. A lot of people are started using masks which they were not using. And it is also possible that Omicron has come in a way which will help human beings to overcome this COVID pandemic itself. Because as Dr. Bagai rightly said about is highly infectious. But in lethality, it is much low. Like in a Hong Kong study, it says that it is 70 times more presence or easily transmissible in bronchus. Bronchus means a respiratory tract, upper respiratory tract. And 10 times lower than in the lungs. Therefore, in Mumbai's CT scan, whatever are done in Omicron patient, nothing is found. And therefore, it is, if you call 70 times more infectious, 10 times less in lung, that means it is 700 times less lethal in totality. And that's the reason outside Africa, we have seen only one death. So when we talk about numbers, we should talk about number of Omicron cases, number of those who are hospitalized or requiring oxygen, and number of those which are dead. So I think the other two parameters are very low. But at the same time, we should wrap up vaccination. We should start pediatric vaccination as early as possible. 3 months before they approve the vaccine, it is not yet available. So I think Government of India should take a cognizance and make it available before end of this year. And 2 to 17 and 2 to 12, two trials are going on for pediatric vaccination. That should be completed. And lastly, I would like to tell that when you look at numbers, you look at UK reporting 89,000 cases a day. UK population is 5% of India. If you multiply that by 20 times, that means India should report 18 lakh cases a day, and at a peak level, we reported 4 lakh cases. India is not going to do that. And if you look at Africa, Africa is much serious than UK, because we have a habit of talking about only developed countries. If you look at Zambia, Zimbabwe, Burundi, Uganda, Rwanda, Uganda is 100% more since last week, but all other countries, Angola, they are 4 times, 5 times more than last week. So it is multiplying every 2 or 3 days there. And therefore, it is going to be a major problem in Africa because Africa is not vaccinated. 90% people have not received even single dose, barring South Africa. South Africa is a little bit elitist country in entire African continent, but rest of Africa is very bad. So our duty is not only to look after ourselves, but also to look after Africa. Start sending vaccine more and more to Africa so that they get vaccinated, so that the churning around the new variants, it will stop. And as there's a disease triangle, in disease triangle is a host parasite environment which decides. Now, parasite is not in our hand. That is the virus behavior. But environment, government policies, that is in our hand, and host is 100% in our hand. So I think we should exhibit our behaviors in such a way that we do not make any kind of nonsense thing to get virus and get infected. And lastly, in a family where 100% are vaccinated, they are better. But in a family, children are there, or old people are there, or somebody is not vaccinated for some hesitancy, that is the worst thing, because you get infection from somewhere. Even if you are vaccinated, you will bring the infection to unvaccinated person, and it is vice versa. So I think 100% vaccinated family will be a little bit safer than those which are partially vaccinated.
Okay. Okay, fair enough. Dr. D.K. Gupta, come in here. Dr. D.K. Gupta, now we are seeing a bit of a spike in Delhi as well, where cases have not risen to astronomically high numbers just yet, but yes, they have now gone up to about 85, 90, along with 10 new Omicron cases. Is that concerning, Dr. D.K. Gupta? And also, do you believe that it is imperative that we step up, the kind of restrictions and perhaps measures being taken at airports and for inbound passengers, looking at the frequency now of people who are testing positive, who've just returned from abroad?
I would like to add to a few points regarding this immunogenicity and the infectiveness of this virus in the lungs and the upper respiratory tract. Like previous speaker has already told it, but I am not agreeing with the one point that it is 70 times less lethal than Delta. The study is done by Dr. Michael Chan in Hong Kong, and they have clearly mentioned that it is definitely the replication rate is around 70 times higher than the Delta, and it is more in upper respiratory tract and middle respiratory, that is up to the bronchus, but it is less than 10 times in lower respiratory tract, that is in the lungs. But it is also, they have written clearly, it is important to note that the severity of disease in human is not determined only by the virus replication, but also by the host immune response to the infection, which may lead to dysregulation of the innate immune system, that is cytokine storm. They also tell that the Omicron variant can be partially escape immunity from the vaccines and the past infection also. The overall threat, I will repeat it, the overall threat from the Omicron variant is likely to be very significant. So we should not take it lightly. It doesn't mean that if it's not replicating 10 times faster in the lower lungs, that it will be it will not create a third wave, or it will not be lethal to the most of the comorbid patients. It can be lethal to those patients, those are having poor immune response or those are having the poor immunity. In these patients, it can trickle down to the lower respiratory tract and it can create pneumonia or ARDS, and it can lead to severe infections, severe complications also. That is one thing. And if we talk about India, we have high population density in India. We have having more than 140 crore people in India. The population density is very high, and it is spreading more than 3 to 4 times as compared to Delta. We have seen in second wave in Delta what happened to India with that spread rate. If it is 3 or 4 times minimum higher than Delta, what will happen? And there are so many comorbid patients also. We are having 40 crore of our population, that is children. They are unimmunized. They are not given in a single dose of vaccine against COVID. They are high risk. They are vulnerable. So it means we should not take it lightly. I think already Hong Kong research has done, and they have told the Sinovac vaccine developed by China that is ineffective against this virus, this strain. Even the vaccine developed by Bharat BioNTech, that is Pfizer vaccine, that is having only 25% antibodies against this new strains. We need some study, we need some results from National Institute of Virology, Pune or NTAG committee, that what is status of our current vaccine against this virus strain. Are they effective? If they are effective, then how much they are effective? If they are not effective, then what are we doing for developing new vaccine against this virus strain? And if they are effective, then why are not we giving additional dose to our healthcare workers or frontline workers and comorbid patients? That is my question to the media and the government. I think we should be serious because it is spreading very fast. Right now, there is more than 100 cases across India right now about Omicron. Even I think there in Delhi, it is increasing. And we have seen in UK also. In last week of November, it was less than 1%. As Dr. Bagai told, it is now more than 5% within 2 weeks also. So it is replicated 5 times, 6 times more in 2 weeks only. Okay. We have seen similar things with the Delta also. In initial month of January, it was less than 1%. But up to August, September, it was more than 80 or 90%. So I think we should not take it lightly. We should follow all COVID appropriate behavior as told by previous speakers.
Okay.
Yes.
Okay. Dr. Bagai, then what should be our priority currently? Should our priority be to begin, the vaccination process, the booster dose process for the frontline workers once again? Should we speed up, the 2-dose completion at least so that it pans out across the length and breadth of our country? Should we speed up implementation of certain restrictions? Should we speed up, the creation of micro-containment zones where Omicron spread is happening fast? What should be our priority right now?
There are many things, but let me just focus on two critical issues. One is the pediatric vaccination. We should not wait for a huge pediatric surge, considering or pretending to say that we have a lesser incidence in children or a lesser disease severity in children. Children carry the same viral load. They can transmit as much as adults, and they show almost the same kind of long COVID effects as adults. Almost 15 to 18% of small kids, even infants of 6 months of age, have shown significant and severe brain deficits 6 to 12 months after an asymptomatic attack. There is also enough data to show that if the children are unvaccinated in an otherwise vaccinated adult household, if one child is unvaccinated, the risk to others to transmit is 13%. If there are two unvaccinated, 22%. And if there are three and above, 54% increased risk of transmission. Just during the course of this discussion, Uday, I have just pulled out a study which was published this afternoon from Rockefeller University, which has shown that boosters unequivocally are required against Omicron. They've done a meta-analysis of more than 1 million odd patients, which have shown both mRNA, ANZ and J&J vaccine, which is Johnson & Johnson, the neutralizing ability of two vaccines, even hybrid immunity. That means people who had previous infection with vaccination has shown a 30 to 180-fold decrease in neutralizing capability of the antibodies. But the third shot, which is now being called as a booster shot, has increased the vaccination, increased the neutralizing ability 30 to 200-fold up. It is clearly required for the healthcare workers, frontline workers, immunocompromised and elderly. We need a strategy in place. The only question is when to start. I very strongly feel that we should start immediately, because it will take at least a period of 2 to 3 weeks for the immunity to build up after the third shot. All the healthcare workers have got their first vaccines in January, February this year. It's already been about 10 to 11 months gap. I'm pretty much sure that our immunity will be waning. So it's important that the people who are here to serve, especially the sick, which are the doctors and healthcare workers, must get the third shot. The third important point is we need a mass public campaign with regarding masking. We need a huge mask campaign. And this mass campaign for masking must carry statistics. There is international data to show that if both people even in a closed room wear a well-fitting N95 mask, the risk of transmitting infection is 1 in 1,000. That means 0.001%. These kind of statistics must be highlighted to a common person. Don't forget your mask. Avoid especially weddings and social gatherings and closed spaces. This is critical at this point of time in the year. Over to you.
Okay, well, let's leave it at that. My thanks to all of our guests for joining us.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.